as we wait. Yay!
Hey, everybody!
Hey.
How's everybody doing today?
Yeah, I can answer for myself. I am super excited, but we're so happy to have you here today. We are doing, in case you're new around here, I am Hillary Buchholz, and I am here with Patty Quinn, and we are the co-founders of We Heart Hounds. But we're so excited because we're also doing another episode of our Ask the Vet series.
Yay! So. Oh, awesome day. These are my favorite days with Dr. Crabtree. Thank you so much for being here with us.
Thanks for having me again. It's good to be here.
You're welcome. Yeah, if you don't know who Dr. Crabtree is, he is Ginger's vet extraordinaire, and just has the biggest heart, and is one of the biggest all-time animal lovers around. And we're just so happy to have you here to answer all of our burning questions as pet parents.
Yeah, absolutely.
So we had asked our audience ahead of time to submit some questions. So we'll start with those. But if you happen to be watching live on whatever platform you're watching, feel free to type in your questions. Or if you have questions as you're watching the replay, you can also type them in there and we will try to get the answers to those questions as well. And so I'm going to just...
Yeah, we got lots of questions to read.
I have my questions written down, so I will read out the questions. So the first question is from Amy, who asks, my Shih Tzu has been sneezing a lot. Should I be concerned, or is this normal allergy behavior? It's hard to talk to a vet since everything is curbside right now. Thank you and have a nice day.
Absolutely. So, no, that's a good point. And sneezing there's a lot of possible causes of it. This time of year, I would say the vast majority of the dogs that are sneezing that have recently started.
Oh, darn it.
Looks like we might have a connection problem.
Yeah.
Is it in there? Can you see me now?
Yep, we can. So if you could restate your answer, that'd be great.
Yeah. So with the allergies, sometimes they need to be treated and sometimes they don't. And so that's obviously something that I would talk to your individual veterinarian about. The good thing is I think a lot of clinics are coming off of curbside care soon. I know for us that's coming Monday. So we'll start letting clients come back in the building that want to come back in the building. But ultimately, if your pet is, again, just like people, if they are dealing okay with the sneezing, they're still eating, drinking, playing, doing all their normal routine stuff, I wouldn't be too concerned about it. Generally, you can try some over-the-counter antihistamines. Talk to your veterinarian about dosing on those, but that's something you can try as kind of an interim between getting medical care or just monitoring them.
Right. And I think there's some allergy supplements out there too, perhaps, that you can, but again, talk to your vet about all of those things before giving to your pup. So hi, Melissa. Melissa says, Charlie Pie and I would like to say hello from Canada. So hi, Melissa.
Hi.
I have the next question. We're going to alternate here. So the next question is from Kelly. And she has an amazing German Shepherd, Layla. We just love Layla. And as Layla starts to eat her dinner, she tends to carry some of her food from her bowl in her mouth over to where my husband and I are sitting, oftentimes from a completely different room. Our other much beloved German Shepherd, Waffos, used to do the same thing. So her question is, what does this represent and what suggestions do you recommend we do? Once she does this, I normally get up and bring her food dish into the room near where we're sitting, just so she can finish her meal there. So is this just like a quirk of a particular breed or a pup, or is this like a pretty common behavior?
Yeah, so it is fairly common, and it's kind of a mix of everything. A lot of it is that dog wanting to be very social. And so she, observes, sees us all eating dinner, and wants to be a part of that. Part of it is that FOMO, fear of missing out. So she's afraid that if she's not right where the action is, that she's going to miss something. And even though we all know a German Shepherd could eat their food in 30 seconds, she's savoring the moment. She wants to make sure that she's catching up on everything while she goes. And so it's not necessarily a problem. Some dogs will take some kibble and go and bury it, and that's different. That's more of like a resource guarding behavior.
Okay.
Again, not necessarily a problem, but
Yeah.
there's different reasons why they do it. None of them are necessarily problematic.
Okay. I think it's just adorable that that their pup would do that. I think that's so sweet. Could it be that they want to share their meal too? I mean, maybe. I don't know if they're bringing it to you.
I say sometimes. Usually, if that's the case, they will come and drop it in your lap, which who doesn't want some slimy kibble dropping in their lap?
Well, it's like a kitty cat bringing a mouse in the house, right?
Absolutely. It's your pet.
That's funny. So I have the next question here from Anita. Her pup Jack was diagnosed with IVDD in January and had disc removal surgery in February. He's never been symptomatic before he hit the dog door, and then he started having problems. Jack is on his way to recovery, but with a limp. It's a cute little limp, though. Her questions are, is it possible for a traumatic event to bring on IVDD, even if the dog isn't symptomatic prior to the event? And are there natural ways to prevent IVDD from getting worse?
Yeah, so that's complicated. And I had a discussion with a gentleman actually yesterday about the same thing. And so IVDD is generally caused by they're called chondrodystrophic breeds. And so what that means, it's a cartilage issue, particularly in the intervertebral disc spaces. So those little are discs. And so in those breeds, which a lot of them are corgis, dachshunds, bassets, but really a lot of our small breed dogs are.
Hers is a beagle. Yeah.
Yeah. So by about 18 months of age, their discs have mineralized, which that process is not painful, doesn't really cause any issues, but the discs have then lost their elasticity. And so it's somewhat of a waiting game to see if and when we're going to have issues. Now, oftentimes there will be that proverbial straw that broke the camel's back. No pun intended. But, they twisted the wrong way, hit the dog door. They were playing tug of war with somebody. And you don't necessarily want to avoid those things because, again, that's not really what caused the issue, but it might have been that final straw. But you still want your dog to be a dog and live a good, healthy life and have interaction. So there's nothing you can really do to minimize that risk other than, I guess, breed selection. But, who doesn't want a cute beagle puppy or the dachshund puppies and whatever it may be. So we shouldn't just hold it against the breed. But they've looked at risk factors as far as, is obesity a factor? Is being inactive or being too active a risk factor? And really, other than breed and genetics, there's no known risk factors. Being healthy and fit leads to generally a quicker recovery after surgery and things like that. So we still want to keep them fit and active, but it doesn't decrease their risk.
Okay. I think I asked you when we got Ginger, she's sleeping here next to me, curled up in a little ball under a blanket. So
yeah, there she is.
Sleepy girl. So I think I asked you, because we just got her about 18 months ago. And I think one of my questions was, because she's so long, as a Chiweenie, she's got that long dachshund body. Should we prevent her from jumping up on the couch or leap, early on as a preventative measure or whatever? And I don't think there's anything we need to necessarily do, right? No, as far as that goes.
The way I look at it is by her jumping and running, that keeps her more fit and active. So she has better muscle tone and hopefully decreased body mass. And so that's all good. Now, if, God forbid, she were to go and develop intervertebral disc disease and herniated disc, then we would probably put her on activity restrictions. So no more running, no more jumping. Sometimes we'll move to a harness versus a collar, things like that. But up until that time, and hopefully never, we don't change anything.
Okay. Yeah. Thank you. Yeah.
What's next?
Is it my turn? All right. All right. So the next question is from Georgie. So thank you for sending this in, Georgie. Her question's regarding separation anxiety. So she just moved to a new house, and whenever she creates her 12-year-old pup, she barks and barks. Now, this is a pup. I've had further conversation with Georgie about this, and this is a pup that's been crate trained, ever since she got her. So very familiar with crate.
Never had a problem.
Never had a problem until they moved to the new house. And so now, at this new house, whenever they leave, she or whenever she crates her, she barks and barks, and she just says, "How do I just get her to relax, like she was before we moved?" So
yeah, absolutely. So obviously, just like in people, anxiety is it's a complicated issue, and it's not a one size fits all kind of thing. So in a case like Georgia, where we have a pretty defined timeline of when it started, it's when we moved to the new house, and assuming it's not a new crate or a different crate, so it's related to location. I don't assume that the new house is any worse for the wear than her previous location. So it's just a new location for her, and for whatever reason, we'll never know, that's causing her some anxiety. So one thing you can try is going back to the basics of crate training to see if it is just she views that as a new crate because it's her crate surrounded by a new crate. So kind of go back to the basics, make it a reward for her every time she goes in or out of the crate. She gets a treat, give her some toys to play with in her crate, things like that. Ultimately, especially in a 12-year-old dog, it probably is separation anxiety, and she's probably just now showing signs of it. And again, talk to your veterinarian. There's different things you can do as far as anti-anxiety medications and calming aids. One of my favorites for the dogs that are very mildly affected is a product called Adaptil. It's a pheromone-based collar. The pheromones are naturally produced when mom is nursing or grooming the puppies, and so they look like an old flea collar. But you put that on, it's temperature activated and works for up to a month at a time, and that can have a calming effect on them. And so that way, she's got that on her all the time. It's kind of a similar concept to the Thunder shirts that work, and still work. But it's a little bit easier to use, I think.
Right. And then maybe kind of like what you were saying with rewarding them, have them in the crate while you're home. If it's a situation while you're away and she's barking, reward them while they're in the crate while you're there so that they're comfortable and things like that. So that it's the only time that they're in there isn't when you're gone. Right. So,
because in a
just kind of
mind,
conditioning them.
Yeah. If you put her in the crate and she barks and barks and barks and carries on, and 10 hours later you get home from work and she's still been barking and worked up, in her mind she thinks that because she barked for 10 hours you came home and finally let her out. So inadvertently we're kind of reinforcing that behavior. So going back to it and saying, here, we'll put you in the crate for 10 minutes, and once you kind of settle down, we'll let you back out, we give you a treat, go from there. So kind of, again, reassuring and kind of repeating the basics for her.
Right. Yep. Okay. Perfect.
So next we have some questions from Melissa. So one of the things, and she has mentioned it again, a few questions. She saw this product called Dog Rocks from Australia that supposedly is 100% natural and proven to help with urine burns on grass. And so she'd like to know your opinion on that.
Yeah, so I'll be honest, I had to do a little bit of research on the product because I hadn't heard of it. So I don't have any experience with it, but my understanding of it is a volcanic rock from Australia that if you put the right amount of the rocks into your pet's water supply, so water bowl, and there's a ratio that you use, it pulls the nitrates and nitrites out of the water, which is apparently one of the things that causes the staining in the yards. I think it makes sense, and I think it could be a good product. I think for me, there's a lot of math and figuring that goes along with it, because I don't know exactly how much my pets drink, and then if you ever dump the water out, clean the water bowl, put new water in, you got to redo the math. And so I don't know how user-friendly they are. I think safety-wise, they would be fine unless you have that curious lab puppy that thinks anything in its bowl is a treat. I don't know if they would eat the volcanic rock or not.
Yeah. All right.
And
well, maybe we should go ahead.
She also mentioned that there are supplements that exist, and I've seen these as well. I never ended up using any of them, so I don't have any firsthand knowledge of them. But I guess my question would be sort of the safety of that. Like, like, are they safe for that? Like,
yeah. So
and is it worth a green grass to put your dog to give something to your dog. Like I would rather treat the grass maybe and not worry about treating the
Put
dog
in
to
turf and be done with it, right?
Yeah, like
Yeah, so a lot of and that's where the rocks are supposed to be a safer alternative because
Right.
they don't alter the pH of the urine. A lot of the products out there alter the pH. The problem is there's a reason we have a normal pH of urine. If you get too high on the pH scale, then we run the risk of being more susceptible to UTIs. If we get too low, then we can increase the risk of certain types of crystals and stones forming. And so there's pros and cons to every aspect of it. I'm kind of on Patty's side. I think I would probably just either deal with the brown spots or try to do something to treat the grass, whether you're adding more water to it or maybe putting some sort of a nitrite blocker on the grass. I don't know if that's possible, but look at it from that angle.
Yeah, something certainly that's pet friendly, but treats the grass and not the pup. All right. So the next question is again from Melissa, and she said she's been hearing different views on what to feed her fur babies: raw food, grain-free, with grain, and maybe adding minerals and vitamins to raw foods, or like, do you have any advice particularly on alternative diets other than the dry kibble?
Yeah, so admittedly, I'm a big fan of most of the dry kibble that's available. There's several good brands. There's a lot of research that's been done on it, and you can bank on it that your pet's getting the amount and the ratio of vitamins and minerals and nutrients that they need from their commercially prepared diets. Yes, there's some I don't like as far as the grain-free diets. They've been linked to an increase in heart disease, and so in general, I don't recommend those. This is more for dogs. Cats don't have as high of the grain requirement, so that's okay. They're more carnivores. If we have a pet that we need or we just really want to do some sort of a home prepared diet, I think home cooked versus raw is going to be safer, just same way it is for us. Handling raw meats, you're in that risk of salmonella and things like that. Home cooked diets, they are notoriously hard to get completely balanced for your pet, but there is a company called Balance It, which so their website is balanceit.com, and they have a great website. You can get on there and say, maybe somebody in the house has an allergy, so you say, I don't want to use anything with chicken in it because I have an allergy to it, and they can make a diet that uses beef or fish, whatever you want to do, and they can help you make a complete diet. And then oftentimes you're just missing some of the vitamins and minerals, and so they carry a supplement, and they can tell you how much XYZ pounds of dog is going to need with their food. They can help you get the right amount of food to give them, how much that supplement to give them, so they get a complete diet. So it's doable. It's just a little more legwork, I suppose.
Yeah. Hillary and I both feed our pups freeze-dried raw food. So it's you're not cooking, it's all the same nutrients, and it's got the convenience of a kibble because it's dry. You just add water to it, and it's the closest to raw with the convenience of kibble, and we both really like that. So there's lots to choose from. Again, talking to your vet about your specific pup, because obviously larger breed dogs need a specific kind of, especially if they're puppies, right, with their bone growth and everything. Like, you just want to make sure that specific breed, that's your specific dog, is getting all the right nutrients that they need.
I think too, also, like, convenient, really do think about the convenience factor for you, because I think we all have the best of intentions, and we want to, like, it would be the best thing if I know every ingredient, if I'm the one cooking it, if I'm the one doing it. But at the end of the day, that's probably not going to fit into most people's lifestyles. And so really kind of taking a look at what's going to work with your lifestyle as well. So finding that kind of balance, whether it's kibble and supplementing, or, do what you think that will work for you, and don't feel guilty about, I'm not doing everything from scratch. Like, you don't need to. There are a lot of good options out there.
Absolutely. And that's one of the bigger drawbacks to the raw or home cooked diets is they don't have the shelf life that a lot of the products do. And so, and I'm guilty of the same thing. If I'm going to cook pasta, then I'm going to cook enough that you can eat pasta for a whole week. And so we've had folks that have done that with the raw or home cooked diets where they make it in bulk, not knowing that with that mix, even refrigerated, it's only good for 10 days.
Right.
So different things to keep in mind.
Yeah, definitely. So we have one more from Melissa. My wonderful and at times not so wonderful fur baby rolled in freshly thawed compost. What is the best dog shampoo / conditioner to help with unpleasant odors?
Poor thing.
Good luck.
Yeah.
I don't know that it necessarily matters which kind. It's just going to be a lot of it. So be prepared to give 2 or 3 baths to get all that out. In general, you're going to want something that will cut through the grease. So your veterinarian will probably have a kind of a prescription, quote unquote, shampoo that will help with it. And of course, it doesn't say grease cutting on it because nobody wants to put that on their dogs. It'll have another fancy term for it that will help to kind of cut through those oils and get that off to get through there. And then I think pet cologne will probably be your friend as well to mask that smell until it wears off.
Took 4 baths, she says. So she just
Yeah, as pet parents, you face every possible situation, don't you? And they are just like kids. Like they get into all kinds of trouble and mischief and things that you wouldn't even anticipate. So this is great. Well, thank you, Melissa, for submitting all those questions. This is wonderful. If anybody else has any questions, again, as Hillary said, please feel free to write them in the comments below, even if you're watching on the replay, and we'll get Dr. Crabtree to answer those for you. I guess we're kind of wrapping up.
Well,
so
I guess, Renee did have a question, just kind of a follow-up to that one. If you could use Dawn, I know we see in those commercials where they're using Dawn to kind of get the oil or grease off of the little baby ducks or things that have, like, would Dawn work to help kind of cut through that grease?
Dawn will. And I tell people to use that all the time. It's a lot cheaper and safer to use that as a flea bath for the cases where they're just covered in fleas and we just need to get the vast majority of them off. It suffocates the fleas. It helps cut the oil, get them all out of there. But yeah, those same things. So any kind of nasty buildup, whether it's something that the dog rolled in or something that we put on them by accident, Dawn is really good, and it's safe even if you were to get it in their eyes. That's where it's really nice. That's why they use it a lot in the wildlife, because they're not going to be the most cooperative creatures. And so either don't wash their head and face, or we use something that's safe. And so Dawn is really nice for that. Of course, just like us, it can dry them out too much. So you'll make sure that you rinse them really, really thoroughly to get all that off. Dry them really good.
Okay. Wonderful. Great question, Renee. Thanks for that follow-up. That's awesome. And thank you, Dr. Crabtree, for all the amazing knowledge that you're sharing with us today. If anybody would like to get in contact with you or learn more, where would you like people to go?
Yeah, so they can follow us along on Facebook, Pendleton Veterinary Clinic. There is the Pendleton Veterinary Clinic in Pendleton, Oregon. So make sure you check your location on that. We're in Indiana, but we are on the website, which is pendletonvet.com.
Okay, perfect. Thank you so much. This is great. Yeah, and on Facebook, it's Pendleton Veterinary Clinic is the tag. So perfect. All right. Well, now for our giveaway winner announcement. Super excited. Somebody asked, any chance you know the equivalent of Dawn in Europe? Yeah, I don't know. And I don't know if you could contact the company to find out if they could ship it to Europe, or if somebody ships it to Europe. I'm not sure. That's a really good question, Pixie. Thanks for asking. If I might do a quick search if I can find something, and I'll let you know. But thank you for asking. Okay, so now for our giveaway winner, we asked everybody to submit your questions and help promote today's interview. And our giveaway winner is Anita Wright. So Anita, yay, you win this little car magnet. It's really cool. Official dog lover, everybody will know. So thank you so much, everybody, for watching. Thank you again, Dr. Crabtree.
Thanks for having
being here. He's in his car, so there's a quiet place because the clinic is a buzz with dogs and kitties and people and all kinds of stuff going on. So thank you for your mobile question, your
No
mobile
problem.
bus there. Yeah, appreciate it. And Hillary, why don't you introduce the little fur ball in your lap, because everybody's going to be wanting to know.
This is Annabelle, and we are puppy sitting for Annabelle. Her mom's in Florida, so Lulu's got a little playmate for the next about a week or so. So we are
awesome.
Definitely enjoying her.
Oh, she looks like a little snuggle bug. Oh my goodness.
Yep. She's pretty much a little Velcro pup. She got dropped off yesterday, so we're sticking pretty close together for right now.
Thank you again, everybody. Thank you, Dr. Crabtree. Really so special for you to be with us. I can't thank you enough. You're amazing. You and your team are amazing. Everybody at Pendleton Veterinary Clinic. So thanks again. Really, really appreciate it.
Thank you, guys.
Thank you.
All right. See you, everybody. Thanks so much for everything. Bye-bye.